Hello, my name is Dr. Beechar. I'm a GP and I'm one of the directors of Medlight and Medical Education. In this video, we're going to talk about maintaining professional boundaries in terms of the GMC Good Medical Practice Guidance and how this relates to your Plab2 exam. So let's take a scenario. Imagine that you are in a GP surgery and your FY1 Hannah asks you if it's okay to meet one of her patients, Susan, whom she's treating for acne, outside of work for coffee. Hannah says, I just want to be friends with Susan because we've got really similar interests and this would just be a friendship, just a platonic friendship, nothing more. And anyway, I only treated her for acne. It wasn't anything personal or awkward. So what do? Well, let's talk about GMC Good Medical Practice. GMC Good Medical Practice states that you must not use your professional position to pursue a sexual or improper emotional relationship with the patient or someone close to them. Now, this is not a sexual relationship, she just wants to be friends. But could it be seen as an improper emotional relationship? That's a grey area, but the general advice is that no, you should not be friends with your patients whilst they're under your care. GMC guidance also states that where possible, you should avoid providing medical care to yourself or anyone with whom you have a close personal relationship. So if Hannah was to make friends with her patient Susan, she would not be able to then provide her medical care. But GMC guidance also states that you must not end a professional relationship with a patient to pursue a personal relationship with them. So it would not be okay for Hannah to say, I won't see Susan as a patient and I will just be her friend, but she will no longer be my patient. That wouldn't be acceptable. So the answer is she should not pursue a friendship with Susan. But when you're having the conversation with Hannah, you can't just say, no, you shouldn't be friends with her. You need to give reasons for this. And just saying it's against GMC guidance isn't good enough. You need to understand and show the examiner you understand why the GMC guidance is there and why it's important. So why is it not a good idea to be friends with a patient? Well, because if you are treating someone who is your friend, you might be less objective. And also, because sometimes people tell their doctors things that they would not feel comfortable sharing with family or friends. So it could affect your clinical care of the patient. And this is what you need to make Hannah understand. How do you have this conversation? Well, as we've said, you need to explain to Hannah why GMC guidance states that she should not be friends with Susan. And you need to ensure that this sounds like a conversation and not a lecture. So you may say something like this. Well, Hannah, I appreciate that you and Susan have similar interests and I can understand why you'd want to make friends with her. But the issue is that if you were to make friends with her, that wouldn't be okay because you're her doctor and it could affect how objective you are when you're treating her. Also, I know at the moment she's only seen you for acne, but say she comes back to see you for something and it's more personal, she might not feel comfortable disclosing it to you because sometimes people will share things with their doctors that they wouldn't feel comfortable sharing with anyone else. So if you were her friend as well, she might not be able to tell you everything. So can you see why it wouldn't be a good idea for you to be friends with Susan? Because it might affect her medical care. So that's how you'd have the conversation. So when you're using GMC Good Medical Practice in your Plab2 exam, you need to show that you understand the rationale for the guidance and you need to speak to a colleague in a way that sounds like a conversation and not like a lecture.